Welcome back to Plastic Surgery Decoded, the podcast designed to help you better understand plastic surgery. We take the mystery out of it in plain language. You'll find it interesting and useful whether you are already planning a procedure or you're just curious. I'm your host, Dr. Regina Nouhan, and we are now into Season 5 of the podcast. After you listen to this episode, know that you can explore and enjoy many other topics, either through your favorite podcast app or through the website at plasticsurgerydecoded.com. The first 40 episodes, or Seasons 1, 2, and 3, comprise the Plastic Surgery Decoded Classics, with my singular voice covering cosmetic and reconstructive procedures, skincare, and general questions about plastic surgery. The remainder of episodes, Seasons 4 and 5, are interviews with my colleagues around the country to help you learn about the subject. A great variety to choose from. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So come along with me as we explore this ever-growing world of plastic surgery. Let's go! Injectables. What are they really? You can find a nice overview in episode 11 of this podcast. But what else should you know? And what are the latest developments? Injectables have become more than just a staple of facial rejuvenation treatment. The explosion of new advances seems exponential. Plus, there are new injectable options for the body. But while all these choices can be exciting, they may leave some people in a quandary. Want to know about the latest? You've come to the right place. Today in conversation, we have Dr. Sachin Shridharani, who is not only an experienced plastic surgeon, well-versed in all injectables, but he has his finger on the pulse of the latest offerings. Listen in as we have a great discussion about this topic people are so drawn to. Here we go. Well, today I'm pleased to have with me Dr. Sachin Shridharani, who is a board-certified plastic surgeon in private practice in Manhattan, New York. Now, he is founder of Lux Surgery, and he also is an associate clinical professor of plastic surgery at Washington University School of Medicine. Welcome.
Thanks. It's great to be here.
Yay, great. Well, I would love it if you just tell us a little bit about your background and how you came to be in your current role, and then tell us the scope of your current practice.
Sure, absolutely. Well, thanks again for having me. This is, such a great opportunity to connect with a fellow Midwestern colleague.
Yay.
I know that we were just talking about that.
Yes.
I'm from the Midwest, was born right outside of Kansas City, Missouri, and
Woohoo.
grew up there, which was really great. Salt of the earth, part of the country. And after finishing medical school, had, enthusiasm and passion, like so many of us do, for the specialty. And ended up on the East Coast at my favorite choice, which was Johns Hopkins, which was an incredible opportunity. So
Nice.
I trained, so it was great, internship, residency, chief residency there. And, what was interesting is that if you called us in the middle of the night for someone who had, unfortunately gone through a windshield, you'd be like, okay, great, let's get to work and do some reconstructive procedures. And if you would have told me, though, on a Thursday afternoon that one of the nurses wanted Botox, I would have probably had a panic attack because we just didn't really learn a lot about aesthetics.
You're much more comfortable with the reconstructive procedures rather than the aesthetic cosmetic procedures.
Absolutely. But I knew I wanted to do aesthetic surgery and aesthetic medicine, but bring kind of the research element to it. So after I finished my training residency, I did one more year of fellowship training in aesthetic plastic surgery, and that brought me to New York City at Manhattan Eye, Ear, and Throat Hospital with some of our famed colleagues that have had a very big interest in academic aesthetics, and fell in love with New York City. So stayed, and as they say, the rest is history.
I can understand that. Oh, yeah. That's wonderful.
So
I'm glad you did.
Thank you. Yeah, so it's great. So I founded my own practice, and we continue the tripartite mission that I learned at Hopkins, which is research, clinical excellence, and education. So those are the pillars of our practice. And it really ties into our core components of the things that we do, and I'm sure hopefully I'll have a nice chat about.
Yeah, I think that's wonderful.
Thank you.
All right. Well, we're here to talk about advancements in the world of injectables, kind of breaking that down into the trends that are going on in the world of injectables and also in the products themselves, the advancements, the bettering of these products. But first, let's provide the listeners with an overall understanding of injectables. That's such an umbrella word. Could you break that down for us? What are injectables and when can they be of help?
Sure, absolutely. So, I mean, injectables have become a very big, broad scope within aesthetics. And, 20 years ago, there was a clear, odorless, water-like solution that became known as a wrinkle eraser, and we call that Botox. And, up until that point, there really wasn't anything that we use in an injectable capacity. Every solution in cosmetic surgery was with a scalpel, not a syringe. And so it's really the advent of that in the early 2000s that changed the way we looked at the face. And the world of aesthetics has never been the same. Because people ask me all the time as a surgeon, like, why do you like to inject? And I was like, well, it's become such this interesting scope of how it parlays in to marrying traditional surgical modalities with advanced injectable techniques. So back to kind of the overarching theme, injectables now are neuromodulators. Those are our wrinkle erasers like Botox, et cetera. We can talk about those. They're volumizing agents like fillers, which can sometimes almost have a bad word these days, but they're not. And those are the plumping agents. Now there's biostimulatory fillers, which build collagen. We'll talk about that. Then there's injectables to permanently destroy fat cells, so we can remove, subtract volume instead of adding volume. There's
Hmm.
injectables for cellulite to improve cellulite. And now there's also injectables with cadaveric fat. So being able to volumize with off the shelf fat. So injectables are no longer just wrinkle erasers, they do a lot of different things.
Yes. And you talk about the advent of Botox, and I remember even a little before that, we used to inject straight bovine collagen. And
Right,
back in
right.
the day, oh my God, it was nice temporarily, but I tell you, people were more likely to get reactions to it, and it didn't last very long. And so it was just a stepping stone towards the modern day fillers. But anyway, so yes, thank you for giving us a really good overview of what injectables, the word injectables, can mean to people. As we talk about some of those workhorses, the neuromodulators, the fillers, the biostimulators, are they still beneficial now? I mean, do you find that you're still using some of those basics in your practice, or are they superseded by other things now?
Sure. No, I mean, they are still a staple in the practice. I mean,
Mm-hmm.
there's so much more now, even so many more options for neuromodulators. It used to be that it was just Botox cosmetic. And then there's Dysport. And then there's Xeomin. And then there became Jeuveau. And
Right.
then there became Daxxify. And then there's Latibo. And then there's now coming out with Relfydess. And so all of a sudden, what used to be one again, clear, odorless, water-like solution to get rid of some wrinkles and creases, we now have so many that have little differences and variations, even different types of neuromodulators or toxins. There's going to be a BONT, right, a type E toxin, which will kick in within a few hours, but it only lasts a few weeks. So there's so many new things happening just in that one
Mm-hmm.
category within injectables. So yeah, we're using them creatively and marrying them again with advanced surgical techniques, but then also using fillers and biostimulatory agents because people are losing so much volume so quickly because, for example, of all the Monjaros and the Ozempic face and all that
Yes, a
phenomenon.
weight loss.
So
Sure.
all those things have really started to create a new avenue for us to not reinvent the wheel, but look at expanded applications of these treatments.
Gotcha. Well, and as we talk of those basic categories, the neuromodulators, the fillers, we'll just talk about those two just to begin with. In your practice, and this is just so the listeners can have a good understanding of this, in your practice, how do you decide when you want to use each of those? What are you specifically hoping each one will do? We talk about a wrinkle eraser, but how is that happening? And there'll be listeners who want to know, can a filler affect a wrinkle, et cetera, et cetera. So tell us how you approach that in your practice.
Yeah, absolutely. So when we're really thinking about how to position these to a patient, it's all about making a diagnosis and creating a treatment plan, not unlike any other part of medicine. And I learned that from thinking about my father, who's a cardiologist, and my brother, who's a spine surgeon. People
Mm-hmm.
don't come into my father's practice and say, can I have 10 milligrams of this cholesterol lowering medicine? And I want 15 units of insulin because I've been eating a lot of cheesecake lately. And you know what? I might want 5 milligrams of blood pressure medicine. They come in and tell him, I don't feel great. And he
Yeah.
makes a diagnosis, creates a treatment plan. Patients come in and they're like, I look tired, or I don't look as fresh, or I want to look younger. So it's my job now to be a good clinician and make a diagnosis and come up with a treatment plan. So that diagnosis involves a full facial balancing assessment. Is the looking at the full face. And is the face the forehead to the mouth, the eyes to the chin? No, it's
Hmm.
the scalp all the way down to the clavicle. And I mean the collarbone. So I start with the full dynamic and static facial assessment, looking at movement, looking at smile lines, laugh lines. And I say, okay, here's an area, for example, for a toxin treatment or neuromodulator, because these lines increases are caused by muscle motion. The person raises their eyebrows a lot. They furrow and get angry or something, or look stern. They're big smilers and they've got crow's feet. Like, okay, I need to relax that muscle group so I can get smoothening. I don't need a filler there, I need a neuromodulator. And that's where I'm going to inject it so that way it helps decrease the interaction between the nerve and the muscle that's communicating. So that's how I would use typically the broad strokes, a neuromodulator.
Hmm.
Now I look at them and I see these really deep under eye hollows, those big parentheses or laugh lines that are deep creases. Maybe their jawline and chin looks a little bit receded. They've lost some volume in their cheekbones and look really flat. I don't want to relax muscles and paralyze their smile. I want to add some volume back in. As you know, as a practicing plastic surgeon and for years until you recently retired, a youthful face is a volume restored face with the
Absolutely.
appropriate skin and soft tissue redraped over it. A young face has that youthful volume, the plumpness, and all those things. And as we mature, because I know none of us are aging, we're all just maturing,
Oh, there you go.
we start to lose a little bit of that volume. So what I do is strategically use these fillers to add the volume of youth back in. So it is all about making that diagnosis and the treatment plan.
Gotcha. Yeah, that's a nice explanation. And as we're talking about fillers, and of course there are just a multitude of options, you just mentioned treating creases under the eyes, laugh lines, etc. How are you distinguishing within the family of fillers what types of product you want to use? You might want to tell us a little bit about G Prime or anything else that you think is relevant to help the listeners understand how you would use a certain product here and maybe not there. Maybe it's not helpful here, maybe it'd be counterproductive.
Sure. Yeah, absolutely. So, it's interesting because we often try to think or are thought of as artists in cosmetic surgery or aesthetic medicine.
Sure.
And so, if we are artists with a syringe or a scalpel, we want as many colors in our palette to be able to use. So, rather than being overwhelmed by the number of fillers now that exist, it's actually great to embrace them and understand the nuances between them so you can get better outcomes. So, when I'm thinking about the fillers within a family, say the Restylane family, it used to be that there was like one or two Restylane products. Now there's classic Restylane, Restylane Lift, Restylane Refine, Restylane Define, Restylane Silk, Restylane Contour, Restylane. There's so many. Juvederm. There used to be one or two Juvederm Ultra Juvederm. Now there's Juvederm Voluma, Volure, Volux, Volbella. There's so many within a portfolio. The nuances between them really tie into a couple of properties. You
Hmm.
mentioned something astutely, which was G prime. G prime is often confused as lifting capacity, but that's actually not the case. It's the resistance to deformation. So it holds its cohesivity a little bit more, which then you can try to extrapolate and think it's going to kind of lift a bit more. But you can have a very high G prime product, but it's got a low particle size, so it doesn't lift as much, but it's quite firm and holds its ground in smaller capacities.
Retains, yeah.
Exactly. So you have resistance to deformation. Understanding those principles helps you get good outcomes. I want a large particle size, high G prime filler in the jawline. Give me that nice structure to create some contour if there's a deficient chin or if I'm losing some volume from years of muscle loss or muscle activation on the
Right.
mandible or the bone. That same product in the lips would be a disaster
Hmm.
because it would be so firm in a soft area that you would look at two hyaluronic acid sausages on someone's face
Yeah.
and lumps and bumps. So I want something softer, lower G prime, so that way it's soft and dynamic. And when you smile, it moves with you.
Mm-hmm.
So tissue depth of injection, the goal of what we're trying to achieve, the resistance to deformation, and the particle size are the parameters that we do to mix and match to find the right location for the right filler within a portfolio.
Excellent. And what about under the eyes? What do you like to use there?
Yeah, so I mean, if you're talking about the full kind of spectrum, within the Restylane family, I love Restylane Refine and of course iLight, which is Restylane Classic. That's always been a really good one there. It doesn't create a lot of a risk of tyndall. Tyndall is the bluish hue that could occur if the filler is too superficial and it creates a
Mm-hmm.
refraction of light, so it looks like a bluish hue. So
Mm-hmm.
that's an important consideration. So I like Restylane Refine and Restylane iLight. If I was using, for example, the Teoxane family, I love Redensity or RHA2 in that region, which is also really nice. If I'm looking at the Evolysse family, I like to use Evolysse Form, which is a very soft product in through there, which you can often use. If I was in the Juvederm family, you can use Volbella to smoothen that area out. You can use Bellatero. So all those have similar principles, which
Mm-hmm.
are very soft and can contour nicely at the lid cheek junction.
Yeah. And not leave lumpies.
No one likes a lumpy there for sure.
All right. And let's talk just a little bit about biostimulators. What is the thinking behind them and what do they do? Tried to build, collagen, elastin, et cetera. But would you just, for the listeners, just tell us the basics of what the philosophy is and what they're trying to do?
Absolutely. So biostimulatory fillers, also known as biostims, kind of colloquially, are dermal fillers or volumizing agents that rather than just volumizing and plumping right away, create their improvement and effect by stimulating fibroblasts, which are important key cells that produce collagen. And there's really basically two that do this. The one that is the hallmark and classic one is called Sculptra. And Sculptra is poly L lactic acid. It sounds scary, but it's not. PLA has been around for ages. It was discovered by the DuPont Corporation, I believe in the 1950s or 60s, and it's been used for sutures. It's been used for a lot of different biocompatible materials, mesh placement, different types of things that absorb. Well, when it's injected, it comes as a powder, you mix it with sterile water, and when you inject it like the consistency basically of water, you're putting the PLA near the fibroblasts, right by the skin, which is where the fibroblasts live and love to be. And basically, you're pretty much putting down like liquid coral, is the way I look at it.
That's a great way to
Lattice.
describe it. I like that.
Thanks. Yeah, so it's like liquid coral. And basically, the fibroblasts are attracted to the PLLA, and then they will basically latch on there and they get stimulated, and then they basically start to create collagen. So,
Yeah.
over the course of several weeks, you start to see a nice gradual change and improvement. And it's
Mm-hmm.
highly regenerative. Everybody's talking about regenerative medicine, regenerative. So, this is kind of a regenerative type of filler.
Yeah. It'll thicken the tissues in that area,
Yeah.
basically.
You can
That
improve
you.
stretch marks, the thinning of the skin that can occur as we know
Mm-hmm.
hormonal changes from menopause, for example,
Yeah.
rapid weight loss. I have so many patients who are on Mounjaro or Ozempic that are coming in because they're losing volume, but they don't want a lot of plumping. They just want the skin to get thicker and lose
Mm-hmm.
some of the finer lines without paralyzing muscles. So we don't always use neurotoxin. We're using our biostims and Sculptra. So that's really important. And then there's one other one also.
Oh, I was going to let me just say, gosh, I remember loving Sculptra in an area of the face that a lot of people don't notice right away, but it is very aging, and that is the hollow of the temple.
Hmm.
And it is just an ideal product for that. I used to love that. So,
Yeah, absolutely. It's fantastic there. And the thing is no one ever comes in and will say, after they get their temples done, like, oh my gosh, Dr. Nuhan, my temples, like you were like the temple queen of the
right,
Midwest. No one ever
right.
knows. It's not like a sexy area
Yeah,
like the lips. But people come in and just say, I don't know what you did, but everyone thinks I just look great. You just look healthy because you don't
yeah,
have that big cavitation, right? I
yes.
tell patients, think about that Edward Munch, The Scream, that classic oil
Oh,
painting
right.
distressed, the temples are caved in, think of a skeletonized person, the temples are caved in. That is such a hallmark of the aging face or being in distress when you've got that cavity or concavity there. So yeah,
Exactly.
spot on.
Yes.
The only other biostimulator, really quick, is Radiesse when it's done in a
Yes.
hyper dilute capacity. And Radiesse is calcium hydroxyl apatite. So it's a calcium based molecule. On its own, it has a very high G prime and a very high lifting capacity and very structural. You would not want to use it as a biostim in that sense superficially because it would leave lumps and bumps and nodules.
Right.
But when you thin it out and you use some normal saline or sterile water and you kind of dilute it and thin the product out, it can also have a similar biostimulatory effect. So those are the two that we have in the US currently.
Yes. Yes, those are classics, as you say. Well, let's talk about whether or not there are some changing trends in aesthetic goals. As people come to see you in the office, if you can kind of consider, several years ago what they were asking for in terms of injectables and now what they're looking for, what have you seen? Or what do they tell you they don't want?
Yeah, I mean, I think patients definitely tell you very quickly what they don't want. And they tell
Yeah.
you, I do not want an overfilled face. I don't
Yeah.
want a puffy face. I don't want a tomato face. I don't want to have this, fullness and puffiness and all that. It's very, very clear that patients know exactly what they do not want. They come in and they say, though, I want to look younger, I want to look healthier, I want to look rejuvenated, but I do not want to look puffy or bloated. And so we see a lot of, is it filler fatigue,
Mm. Hmm.
filorexia, all these
Mm.
different terms we call
Yeah.
them. So we just are very cognizant to not overcorrect people anymore. So that's probably one of the big things that patients know exactly what they do or don't want. Um, Separately, they're asking for new options and new materials. Is there something else? And that's what's given us an opportunity, especially with body contouring, to look at different options, which I'm sure we'll get into in a little bit, like, the
Mhm.
off-the-shelf fat product.
Yeah. And I also would love for you to address the concept of static appearance versus dynamic appearance. So often, people will look in the mirror as they're, getting filler and they'll say, "Ooh, keep going," or "Oh, I like that," or da 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 da. But the dynamic is a different story, isn't it?
For sure. So in the palm of my hand right now is a supercomputer, and it's called an iPhone, right? This thing
Right.
links you to the entire world at all times, basically. And unfortunately or fortunately, it also has a really nice camera on it. And so everyone now is a photojournalist. Everyone captures every element where I get to see a million pictures of them in different lighting and different, scenarios, and they point out this is what I don't like. Well, what we also see are tons of video, tons of, we've got social media. We don't live in a static world, right? We
Exactly.
live in a very digital, dynamic world. And so whether it's AI, whether it's Facetune, whether it's the filter on your phone, the filter on Instagram, filters on TikTok, whatever app or product you use, you have the ability to tweak yourself and basically make yourself kind of look like the best or sometimes not always the best version of yourself. And people use that as inspiration and come in. So that dynamic assessment is very, very important because we don't live in a static world. We don't live in a 2D before and after Polaroid or that type of world anymore. People come in and they'll show me videos. This is what I look like when I was speaking. This is what I look like when I was with my partner. This is what I look like when I was at my wedding. This is what I look like, whatever it is.
Hmm.
I love this or I do not like this. This is what I looked like a year ago in the same light, the same hotel, that kind of thing. And so you're just constantly needing to keep up with and chase the ability to look at dynamic smiles and motion to make sure you don't paralyze or freeze someone's face.
Yeah, I mean that's the key. I think is that you might look great in a static picture. And we've seen celebrities like this, but as soon as we see them try to speak or move or express their face, they just look off. They don't look good.
Yeah.
So yes, the dynamic versus static I think is important. These days, are people asking to look more natural? Are they asking for longer lasting products? Are they asking for preventative treatments? What are you seeing?
Natural as in you hit it right on the head. Patients are coming in, they want to look like the freshest version of themselves, not like a different version of themselves. So they
Right.
are definitely looking to have a very, very natural look and natural aesthetic. It's all about being refreshed, rejuvenated, less is more. What's interesting though is sometimes to get that look, you have to do a lot more. Facial
Mm,
balancing means that you're putting a little bit in the temple, a little bit in the smile lines, a little bit in the cheeks, a little bit in the jawline, a little bit in the chin, a little something in the platysma. It's about balance. So sometimes patients will be like, I didn't really want to do that much. And you're like, trust me, let me show you. You do it, and they're like, oh my God, it looks amazing. But then you realize you needed to do tweaks kind of everywhere to
hmm.
give them the best outcome.
Yeah. I think that's valuable information because a lot of people are a little gun shy and they just, hey, I just want to try this or this. But if you understand the full picture and perspective, you can really enhance the outcome. I think that's great. Well, let's get down to it. Let's talk about new products or even new uses of existing injectables. What's available now, kind of in those categories we talked about, and what's happening basically?
Yeah, so I mean, I think what we're seeing is an explosion of new indications of products that we feel comfortable with. So
Mm-hmm.
we're finding, for example, that we can sort of rob Peter to pay Paul. And what I mean by that is, like, think about Restylane Silk. That was a challenging product in the lips, a lot of swelling, drew in a lot of fluid, but when used correctly in smaller aliquots, it's become, we did the clinical trials for it for the décolletage, right? For the décolleté, almost like a skin
Yeah.
booster, right? And that's
So
exactly what it's called.
the
Mhm.
upper chest to neck for people who don't know what that is.
Exactly. It's kind of that junction where the skin kind of starts to thin before we get to the breast tissue,
Yes.
but below the collarbone, sort of that area that can be exposed and get a lot of sun damage and thin out over your sternum, the
Yeah.
breastbone, so to speak. And so here we found the right place for it. We think about, like, prime example with some of the HAs like Voluma. Voluma has been the gold standard in the cheeks and the mid face for so long. And then we found a new expanded ability to create really nice contouring in the chin with it. So injecting it on the central portion of the chin or the mandible to be
Mm-hmm.
able to give us more length to the face or more projection if you have a receded chin. So these are
Sure.
some of the innovative and creative ways, is finding something that's worked well or sometimes hasn't worked well in one area, but it's a safe and good product and we repurpose it. So
Yeah.
that's definitely something that's been really kind of happening a lot, is expanded indications. And that's nice
Mm-hmm.
because we have safety, data, and guidance on how to treat the full face. Because you can't teach or train from a company perspective or for a lot of these different organizations if you don't have an FDA approval. So you can't just be a charlatan and just do whatever you want with it and
Mm-hmm.
just say, well, it worked great by my nose. Let's just inject it in my ear. Like, it doesn't work that way.
Right.
On the toxin front, it's all about innovation. So there are two new ones coming to the market to the US this year, which are really innovative. One is Galderma's Relfydess, and the other one is Allergan's Trenibotulinum. And
And how
these
are those
are pretty
different
cool.
from standard Botox?
Yeah, so standard Botox is botulinum toxin type A. There's tons of different serotypes of neurotoxins. So botulinum toxin type A, or Botox, is what we're accustomed to thinking about. And those are the ones I said earlier: Botox, Dysport,
Right.
Daxxify, etc. And they are all derivative of something called the Hall strain, which is the historical strain of botulinum toxin type A. Well, with Relfydess, it's a brand new strain of type A toxin that was found in the soil in Poland. So the story is crazy. They wanted their own strain. They went scouring the earth. It's like Jurassic Park stuff, right? Like
Oh my
archaeologic
gosh.
digs looking for this, Clostridium genus in the wild, and they found it in the soil in Poland. So now they've captured it, cultivated it, did all the things they need to do, spent
Yes.
the last 15 years studying it, and now have a new strain. But what they're able to do with it is stabilize it, and we have the first ever liquid toxin that's coming to the United States. And so rather than it being a freeze dried powder that you reconstitute, meaning mix with sterile water and do the
Mm-hmm.
whole thing and mix it and
In
swirl
the
it and draw
office.
it up
Yeah.
and on the
Mm-hmm.
office, preparation is immediate. So it increases efficiency, decreases medical errors because you're not mixing something and all that. But it's also a different strain that seems to kick in pretty quickly and last longer. So these are
Mm.
all pretty unique principles of a brand new strain. So that's what that one is.
And how long is that one lasting compared to other products?
Yeah, so great question. We're always so careful on duration because how does someone
Yes.
actually say how long something lasts? Is it The
Yeah.
second you get some motion back is the second it all comes back. What we can tell you from the clinical trials is a significant percentage of individuals had not returned to their baseline wrinkles at
Hmm.
6 months.
That's
So
incredible.
it's pretty neat.
Yeah.
So, I think we've got something, and like 40% of people noticed a substantial change at 24 hours. So it kick
That's
in
a step
quick.
up as well. Oh my
Yeah.
goodness. Yeah.
So early onset, longer duration, pretty exciting
Because
stuff.
normally it would take patients how long
Yeah,
to
some people start to
onset?
see things, between 3 to 5 days, and it peaks around 2 weeks, and then
Yes.
it lasts 3 to 4 months.
Yeah. So
So
huge
yeah,
improvement.
yeah. And then the
Good
other
deal.
one, the Trenny botulinum, also really cool. That's a type E. So it's the first time in the world we've had a type E neurotoxin, and this one has a very rapid onset. Get injected in the morning, and by that evening at 8 hours, people start to see a big difference.
That's
So
incredible.
it's kind of cool for a social emergency. Like, oh, forgot about that
I
date this
like that.
weekend. Gotta look great.
Yeah.
It's
Right.
Friday.
Right.
Gotta look good by Saturday. But it also cuts off really quickly. So 2 to 3 weeks, you're back to baseline. So it's short acting, but rapid onset. And
Yeah.
that one's pretty interesting too.
Yeah. So if you don't like the look, it's going to go away. So
That's exactly
there you
right.
go.
Try before
Yeah.
you buy.
Exactly. Um, Tell us about regenerative injectables and exosomes and things like that. Where do we stand with all that?
Yeah, I mean, regenerative is its own, like, how much time do we have, right? Like we need
Exactly.
how many more of your amazing podcasts can we do together talking about
Oh my
regenerative
gosh.
medicine? We need a primer on that. So there's so many things happening in regenerative, right? And the big one's probably like the polynucleotides, the PDRN. That's like the
Yes.
salmon
Yes.
sperm facial. So people are
Yeah, the
finding,
salmon DNA. Yeah.
yeah, exactly, the DNA component of that, the polynucleotides, growth factors, PDGF, right? Platelet derived growth factor. I
Hmm.
often say it's like, okay, PRP, PRF, PDGF, PDRN, WTF, right?
About all those P's.
What is going on, right? So,
Yeah, right.
so many of these different principles and properties, but they're basically cell signaling molecules. They all basically are predicated on there's tissue trauma, right? We microneedle, laser the skin, dermabrade, do something, beat up the skin, and then use these growth factors to heal the skin in a more rapid way and fortify it. We want to
Hmm.
signal and trick the skin into upregulating the growth factors and healing components. And these cell signaling molecules like exosomes or these platelet derived growth factors, all those different tissue products basically are communicating to our body heal fast and heal strong, right? So
Hmm.
that's at a very kind of cursory level the way they work. So
Yeah.
those are also big in the regenerative world.
Yeah. And I love that word you use, fortify, because it's
Hmm.
not just healing, but it's, strengthening the skin tissues. So I think that's great.
Yeah.
We alluded to this a little bit earlier, but I'd love to hear you expand on it. And that is what I'll call processed fat. What
Mm-hmm.
is it? What can you do with it? And now we're talking about not just, you know, injectables for face, we're talking about body. Why don't you give us the lowdown on that?
Sure. So the body has become the new frontier because for the last 2 decades, the focus has been on all these products for the face and above the collarbone. But now we have something that's really, and it's very, very timely because as we know, with those GLPs that we were talking about earlier, like the Mounjaros, Ozempics, Wegovy's, Tirzepatide,
Mm-hmm.
all those different products, one of the big issues is rapid volume loss and weight loss. And guess
Mm-hmm.
what? You don't get to just lose it from your gut or from your neck. You lose it from your butt, your hips, your breasts, all those different areas can start to get deflated. And up
Right.
until now, short of you putting in an implant or doing other complex surgical procedures like fat transfers, if you have any fat left, we really
Mm-hmm.
haven't had a good alternative or option. And so here comes Alaclay, which came out a little bit over a year ago. And Alaclay is the world's first and only hybrid off the shelf fat, intact cadaveric fat cells, mixed with the ECM, extracellular matrix, which is the supporting scaffold in tissue that the body has, which is nourishing to the existing alloclay, but also is very inviting to your own body cells to produce your own fat and collagen. So
Mm-hmm.
alloclay is fat cells plus the extracellular matrix
And
meant
the
to
fat cells come
use
from.
cadavers from people that have gifted their bodies to science.
Mm-hmm.
Not unlike, and people kind of freak out. They're like, is this like the zombie butt lift or what is we doing here? They talk about that. Look, this is not unlike if you had a ruptured Achilles tendon and you don't want the orthopedic surgeon to strip tendon from your other tendons, they will
Exactly.
use cadaver tendon. If
Yeah.
you needed a lens for your eye, most people don't donate their lenses while they're alive. So you're using a lens replacement that's coming from a cadaver.
Yeah.
Yeah, or a cornea. If
Mm-hmm.
you got dental work and you need bone graft, the dentist usually isn't opening up your pelvis and stealing bone,
Right.
cortical or cancellous bone graft. They're using cadaveric bone graft from dead people to fill in, your maxilla to give you stabilized bone. So we use cartilage grafts, we do all these things, bone grafts, all these tissue grafts. This is not unlike any other tissue product that we've been using for a long time, but it just so happens to be fat.
Yeah. So, how do we use this product? How
Sure.
do you like to use this product in your practice? What's the range of things you could do with this?
Yeah, so we use it exclusively below the collarbone, right? This is
Mm-hmm.
not good for the face. It's too thick. There will be a face product in the future, but for now, we're using it for the breast and for body. So the indication for it is really anywhere on the body that already has pre-existing fat, which
Mm.
is a very, very nice broad indication, which
Yeah.
speaks to the quality of the studies and what the FDA thought of the product to give it such a wide approval. So, what have I used it for? I've used it for everyday fat transfer to the hip dips and buttocks for someone that has droopiness or sagginess or those concave hip dips when they wear their favorite yoga pants or fitted dress.
Sure.
So this has been
Sure.
a great area because you don't have to have a full fat transfer. Someone who's been on Ozempic, lost volume and projection in their butt, but they don't want a full body lift, I can use Alaclay to give them some projection back for their butt. I've used it for breast augmentation on thin women who do not want to implant. They don't want a foreign material in them, and they don't have enough of their own fat. So I can use this to create a beautiful breast augmentation that's soft and natural that doesn't involve an implant. A patient today, for example, I treated has rippling from her previous breast implants, but doesn't want to have all the implants taken out. There's no problem, but she's lost weight, so you can create a nice little buffer. And one of the
Yeah,
most
that's great.
gratifying treatments, and I have this case tomorrow, is a patient who's had poorly done liposuction elsewhere, unfortunately, and has a lot of track marks, grooves,
Yeah. Yeah.
divots, burns
Yeah.
from too much laser or
Oh
ultrasound and
gosh.
heat
Yeah.
trauma. So I'm going to go in there and use Alaclay to recreate a thin layer of fat as a buffer between her
Mm-hmm.
skin and muscle. And I've done that all over the body: thighs, calves, ankles, arms, abdomens, flanks, you name it, we've treated it.
And you're finding a stimulatory component as well?
Yeah,
Can
absolutely.
stimulate growth in that area as well? Yeah,
Yeah,
that's
it's
wonderful.
pretty incredible science.
Excellent. Any problems with tissue reaction or anything like that? Irritation?
Yeah, great question. Anytime you use any tissue product, there's going to be some previous genetic component. This is well below the FDA safety threshold. But with
Great.
that said, there can be a little localized reaction. In my hands, what I've seen is less than 5% of our patients have a temporary sort of reaction, some redness or
Mm-hmm.
itching in the
Mm-hmm.
area. And it's just because the tissue is incorporating this new tissue in, and that creates a localized little inflammatory reaction. We treat it with actually allergy medicine. So your Zyrtex, your Claritins, your Allegras, even
Antihistamine
topical,
stuff. Yeah, that's great.
exactly, antihistamines, and sometimes a topical steroid, and it goes
Yeah.
away without a problem.
Oh, that's wonderful.
Yeah.
And then what kind of volumes does this product come in? If you're doing a breast augmentation, I would think you need a fair amount of volume.
hmm
How does the product come?
Yeah, the product comes in 12.5 cc syringes. So
Mm-hmm.
each pack is usually two 12 and a half syringes, 12 and a half cc syringes, so 25 cc's. My typical breast augmentation patient needs anywhere between 75 to 150 cc's per each side. So it really
Mm-hmm.
depends on how much of their own breast tissue they have, what are they
Right.
looking for, what are they hoping to achieve. Yeah.
You know what I think is really impressive with the way that injectables overall have progressed is that there are just more options now. And it really allows you to personalize a treatment plan and product type for specific patients, specific skin needs in particular.
Yeah,
I'm sure you're finding that.
yeah, absolutely. I mean, there's something for everyone, which wasn't always the case in the past. So you can look at what that person's skin quality is, what their texture is, what are they looking, what do they need volume, do they need more elasticity? Do you need more of a thicker skin? Are you young and just have a lot of volume loss because you went on a weight loss journey? Do
Hmm.
you have implants that got a capsular contracture and they need to come out and you don't want implants again? So now you're just going to walk around without any volume in your chest versus being able to have. It's just the breadth of it is so great. And the thing is the technology and the new materials are expanding so rapidly. We're
Mm.
running clinical trials on silk-based products, alginate or
Yes.
algae-based
Yes.
products, collagen harvested from tobacco. Like, think
Oh my
about a
gosh.
recombinant product where you are finding a way to regrow collagen or get collagen extracted from a tobacco plant so you don't have the reaction that you used to with the bovine, right?
Right.
Or the rooster comb, right? There were two options. You could either
Oh, right,
have
right,
it
right.
harvested from roosters or from cow. And now you're like, okay, well, now we have it from a tobacco plant, which doesn't have the animal-based reactions.
Yes.
So
Yes.
many advances on the horizon that we already have. It's sci-fi, but here.
But in a good way. I love it.
Exactly.
Well, I would love to know what some of the most common misconceptions are about injectables that you find as patients come in for their consultation. Do they feel like with injectables they should be able to avoid a facelift, or that the injectables will last forever, or what are you hearing?
Yeah, so I'd say some of the pitfalls or things that we see or hear. Number one is there's patients who do feel, and you said it well, that if I do enough of this, I don't have to have a facelift, anything to avoid a facelift.
Right.
And you're like, okay, your head looks like a helium balloon right now because you had so much volume put in to make your skin
Oh
taut.
my gosh,
Like, we got
yeah. To
to,
fill
this
it
is,
up, yeah.
yeah, exactly. This is not the right answer. So that definitely is one of them. I think probably the other thing is when patients are vastly disappointed because of the longevity effect. People have promised them, oh yeah, do all this and it's going to last 2 to 3 years.
Mm.
And 9 to 10 months later, they're back and they're like, look, it's not all gone, but I'm really worried that 50 or 60% of it is. But probably one of the biggest myths that we've been dispelling or kind of myth busting is that if you have injectables, you can't have a facelift.
Oh,
Or if you're planning on ever getting a facelift, don't get any injectables.
yeah.
And we just know that to be completely false.
Yeah. What do you tell them?
Surgical procedures are complicated by poorly placed or poorly performed injectables.
Hmm.
You're injecting it into the muscle. You're injecting it into the deeper layers or certain places it doesn't belong. You're injecting it directly subsmass into the deep plane, which is going to have an impact, or you're injecting it into the parotid. Like, you made a mistake. You didn't put this in the right location. So, yes, of course, you're going to create complications and challenges. When performed correctly, coming from someone who operates multiple days a week and also injects several times a week, I would not do a
Hmm.
procedure knowing that I'm going to make it incrementally harder for me to take care of this patient surgically in the future.
Yeah.
My
Yeah.
hope is to make patients happy with injectables, but when they're ready for the scalpel, they've got the trust and confidence in me. And so I'm always thinking when I'm injecting a patient, let's say I'm doing their tear troughs, like around the under
Hmm.
eyes, I'm
Yeah.
like, I may have to do a blepharoplasty on this patient in 1, 2, 3, 5 years. So I want
Hmm.
to do right by them, right? Or
Hmm.
if I'm injecting someone's jawline, I'm thinking I may need to do a neck lift on them. Let's be very careful of where I'm putting all that filler and if it's going to make my life miserable or make it impossible for the patient because you created scar tissue or problems. So we're always thinking
Right.
about that.
And I would imagine also that you find to give a patient a full rejuvenation effect, you sometimes use a combination of surgical procedures and injectables. Is that the case
Absolutely.
for you?
Yeah, definitely. Like,
Certain things surgery can't do, and certain things
yeah,
injectables can't do.
listen, when people who are only able to inject ask me about certain complex issues and how do they fix them or how do they treat them, my response sometimes is, heaven forbid we ever use a scalpel. Okay? Like, you may
Have
actually
you thought
have
of
to,
that?
yeah, this might be surgery.
Yeah.
I'm sorry, not every problem can be solved with your syringe. you may want to refer that out to a surgeon, and that makes sense. The flip side is when I see surgeons doing, frontalis resections during a brow lift or scarring up and stripping off the procerus or the corrugators from the glabella and supraorbital rim
In between the
muscle.
brows, yeah.
Exactly. I'm like, there's this clear odorless water-like solution called Botox. Could we
It'll take care of
use
that.
this and it'll take care of that problem? Come back a couple
Right.
times a year. You don't have to cut muscle out of their face. Let's
Yeah.
avoid that.
Oh, gosh, of course. And are there any times when you feel like injectables are just flat out contraindicated? Are there certain situations where you feel like we should not do that?
Oh, yeah, absolutely. I mean, there are patients who, for example, especially like in the periorbital region around the eyes, like
Hmm.
when I see people injecting almost in the orbit of the upper eyelid to try to make it youthful because they've lost a lot of volume or look hollowed
Hmm.
out, I'm like,
Hmm.
it just doesn't belong in the orbit. Like,
Yeah.
you're going to hit the lacrimal gland, they're going to have
Uh,
problems with their tearing, or when
yeah.
someone needs a lower blepharoplasty, they've got those big pads, those big bags, right? Those fat pads.
Yeah.
And
Yeah.
we're loading them up with so much filler that they look chipmunk like when what they
Yeah.
needed was an elegantly performed eyelid procedure to remove the fat and redrape the skin or laser it. So I think it's just about like good medical care and good judgment.
Yeah. Truer words were never spoken. Right there. We have really covered a lot of ground here. I just have a couple questions I want to finish up with, but
Sure.
I'm curious if you see anything new on the horizon, or is there something you'd really like to see further developed? What are you most excited about that might be coming our way?
Oh gosh, that's so tough. I really would love to see tropoelastin start to emerge. And what that is basically the precursor for elastin fibers. And so
Hmm.
those are the fibers that give us our resiliency back to the skin. When the stretch mark is basically a tear in the skin without it
Hmm.
bleeding, and it's from the
Yeah.
stretch component. But what if we could get the distensibility and the resiliency of skin back? We know how to replace hyaluronic acid. We know how to create collagen. We know how to melt fat. We know how to dissolve cellulite. But what we haven't been able to consistently do is get the resiliency and the distensibility and stretchability of skin back. So I'd
Yeah.
love to see that molecule make big strides so we can treat skin quality and tissue.
Oh, I think you're spot on. I think that's kind of what's missing. And I think everyone else would be on board with that. So great idea. Well, gosh, thank you so much for all of your comments and education that you've provided the listeners. I'd love to know if you have any last thoughts about injectable trends or just about plastic surgery in general. What would you like the listeners to take away from our conversation today?
That aesthetic medicine and plastic surgery, when performed correctly, are the most gratifying procedures to receive and to be able to perform, right? To be able to take something that's already in pretty decent shape and work towards perfection is a challenge, but it also is incredibly fulfilling. And so I think finding the right partnership and the right surgeon is so important for our listeners. And if you are an educator or someone, take the ownership of learning about all the different procedures and how rapidly expanding our practices are.
Ah, I think that is well said. Wonderful. Well, Dr. Sachin Shridharani, thank you so much for being with us today. You have really elevated everyone's understanding of injectables, and I think we're all excited about what might be coming next as well. So thank you for taking the time.
Thanks.
Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.